It was a chance to visit NUS, and I was so impressed with the people there. People are really positive, active, and lively. So I came back to Japan and talked to my friends and team members about how the NUS was wonderful, and many people agreed with my opinion. And so that's the start point of planning this event.
I enjoyed the presentations, all of them today, and I think what I really like is the passion of the investigators or researchers in Yokohama City University. I think they are very enthusiastic and very genuine in their interests, and basically these are the people I like to work with. For me, my approach has always been that if people want to work with us, we will work with them. I can feel that interest very strongly in YCU. I look forward to making more plans to work together, both at education as well as in research.
I would like to point out the level and the achievements Singapore has made in creating translational programs. And I think it would be very good for us to learn how they have achieved it. So in order to create this kind of platforms, we need to focus on everybody separately, but also very importantly, put them together and remove the fragmentation in everyone's effort. And that's truly remarkable what they've done.
It was my pleasure demonstrating our catheter simulator. For me, the simulation training helped a lot in terms of growth in my procedure times. And I hope the simulator grows worldwide and also in Japan too.
I think what I found is that YCU has some real strength in some areas. For example, in neurosurgery, in urology, in big data. So I was really happy because over the course of the last 2 days, I've actually already identified some potential collaboration with colleagues back home, which I've connected, and also my personal research potential collaborations there as well. So these were great finds for me.
Today I participated in some presentation, and when I listened to the NUS professor's presentation, I clearly remember the time I participated in the simulation program in NUS, and it made me feel motivated to study again.
If you're really interested in research, you should be curious, you should have an open mind, try to learn as much as possible, and try to connect new things that you learn with your own areas of research, because then that will open new doors and new possibilities and new collaborations. I thought the organization was very well done. There was a mix of discussion, lectures, and then also a hospital tour, which was very interesting for us. Maybe next year, if I'm invited again, we should have hematology as a discussion point, because I think you have very strong hematology department as well. But I think it was very comprehensive already, the program. Well, I was very impressed, although when we first thought that this was a secondary hospital, very small hospital, less staff, it was lower care provision. But I was very impressed that they had a full suite of complex care, including for heart disease, cancer, and they even had robotic surgery. And I realized that even though it's a smaller hospital, the quality of care was excellent for the people living around it. And more importantly, I was very impressed with the staff that was there, who really felt energized and inspired by their role, how they could do for the community.
Some of the most interesting discussion points I found so far is the keenness of both universities to collaborate on both education and research. Particularly for myself, I was very interested to look at the early pancreatic cancer detection program, and I find that very insightful, and we're looking forward to have a collaboration together with the team after our discussion today.
So I think in the 3 days here, we learned from our Japanese counterparts that many of the issues that we worry about are actually very similar. In fact, for example, in the area of aging, Japan is 10 years ahead, and we're trying to learn from them because Singapore is also one of the fastest aging country, and there are a lot more commonalities, and even in the differences, these are areas where we can learn new things from.
My message to the YCU student is that I think there's a lot of great opportunities to come. You have a good university that will support your learning and growth. So continue to learn and be excited in the new area of discovery in medicine. And more importantly, I think whatever that we have learned here, we must be able to translate into helping our patients in the future.
This first visit is an introductory handshake. Moving forward, we hope to capitalize on what we have put in place and allow our research groups to come together. So certainly going in depth into exploring what are the potential things that we can work on a thematic level, as well as more deeper discussion to see where we can push the frontiers of science. I think that will really be the acid test of where we can bring the whole science forward to improve healthcare within the community.
Hello, this is Dr. Ishikawa, the president of Yokohama City University. Thank you very much for visiting us and spending 3 days with our faculty members, students, and staffs. We had great time with you, and we also hope that you had a great time in Yokohama. We wish to continue these great events next year as well. And also, we wish to visit your university in Singapore sometime in the near future. We can deepen and strengthen our ties, friendship, and communications so that we can grow together towards the next decades.